This is Philip Ador, founder of NCLEX RN 45-Day Challenge. In this video, I'm going to be talking about phenylketonuria. Phenylketonuria, or PKU, is a rare metabolic disease that can lead to severe brain disorders caused by the accumulations of the amino acid phenylalanine to toxic levels in the blood and the brain. Amino acids are the basic building blocks that make up protein. Phenylalanine, or PHE, is one of the essential amino acids. It is necessary for life, but our bodies can't make it. Phenylalanine must be acquired through foods that contain proteins. Normally, once phenylalanine enters the body, most of it is converted to tyrosine by the enzymes. Phenylalanine hydroxylase. Tyrosine is then turned into neurotransmitters important for normal brain development and functions. PKU is an autosomal recessive genetic disorder that affects functions of the phenylalanine hydroxylase enzymes. The phenylalanine hydroxylase gene is located on chromosomes 12 and over 600 mutations been described. In PKU, elevated phenylalanine levels and reduced tyrosine levels can change the way the brain functions. This is because phenylalanine uses the same transporters to cross the blood-brain barrier as other amino acids, including tyrosine and tryptophan. Tyrosine is needed to synthesize the dopamine and norepinephrine, and tryptophan is needed to synthesize the neurotransmitters serotonin. As phenylalanine levels rise, it occupies all the transporters, making it hard for the tyrosine and tryptophan to get across the blood-brain barrier. As a result, dopamine, norepinephrine, and serotonin levels in the brain begin to fall, leading to abnormal brain development and intellectual disability. Testing for PKU is typically done as part of routine newborn screening approximately 24 hours after birth. Screening is done by taking small blood samples from the heel stick and measuring blood phenylalanine levels by a simple laboratory test. If the screening test shows high levels of phenylalanine and shows blood tyrosine, a different method is used to repeat the measures of the blood amino acids and to confirm the diagnosis. First-line therapy for PKU is the Low Phenylalanine Diet. This includes medical foods such as low or no phenylalanine medical formulas that are synthetic form of proteins, and foods modified to be low in protein. All high-protein foods such as meat, fish, eggs, and dairies are eliminated from the diet. Measured amounts of some grains, vegetables, and fruits are allowed depending upon the individual's patient's tolerance of small amounts of phenylalanine. Each patient will need to customize the amount of phenylalanine dietary intake with medical professionals according to the individual needs. In addition to the low phenylalanine diet, 2 FDA-approved pharmaceutical treatments are now available. Kuvan is a factor for phenylalanine hydroxylase, which helps improve the PKU on patients' innate. Palynziq can be used in adults with PKU. Palynziq is an enzyme injected under the skin every day by the patient that circulates in the blood, metabolizing phenylalanase and substitutes for defective phenylalanine hydroxylase enzyme. Palynziq works well for many adults and PKU patients, but can have serious side effects in some patients. Alright, as a quick recap, in PKU, phenylalanine levels build up and tyrosine levels drop. Symptoms in untreated individuals include seizures, severe developmental delay. In the US and much of the developed world, newborns are routinely screened for PKUs. Treatment initiated soon after the birth is based on a diet low in phenylalanine that requires the use of an amino acid-based medical food formula. Severe restrictions of the dietary natural protein intake and the ingestions of modified foods that are lower in proteins. 2 FDA-approved drugs are also available for the treatment of the PKU.